A report released today is providing a comprehensive look at the state of mental health for LGBTQ plus youth. The two-year study by the Trevor Project shows a stark jump in young people reporting symptoms of depression, anxiety, and even suicidal thoughts. Jaymes Black is the CEO of the Trevor Project and joins me for tonight's interview. Thank you so much for joining us. What strikes you, what are the major takeaways from this study?
Thanks for having me. So this new study shows that the mental health crisis impacting LGBTQ plus youth in America is growing worse. And what this study affirms is whether it's mental health services, supportive policies, medical care, economic security, or safe spaces, LGBTQ plus youth face a shortage across the board. And now at the start of this study, LGBTQ plus youth already reported higher levels of mental health distress. Their rates were even higher after year one. And this means that they are reporting elevated rates of anxiety, depression, suicidal ideation. Anxiety symptoms rose from 57% to 68%. Depressive symptoms climbed from 48% to 54%. And suicidal ideation grew from 41% to 47%. And something that is also disturbing is that far too many young people reported that they have been discriminated against, physically harassed, or threatened because of their sexual orientation or gender identity.
And Jaymes, within the LGBTQ community, did outcomes vary, or was this across the board?
Outcomes did vary. So the rates are most pronounced among transgender and non-binary youth. 40% of transgender and non-binary youth said they were physically harassed or threatened because of their gender identity. 66% said they experienced anti-transgender discrimination. Now, we heard quotes like, "There is no feeling worse than not being taken seriously or accepted." Or in some places in school, I'm affirmed, like specific teachers, offices, or classes, but some teachers are transphobic and I feel unsafe around them. And so heartbreakingly, transgender and non-binary youth were nearly 3 times more likely to attempt suicide in the past year compared to their cisgender peers. And John, while this is devastating, it is not entirely surprising. Transgender youth have increasingly been used as political talking points. The rhetoric and policies that target these young people take a real toll on their mental health.
And the research also collected data on protective factors. What are some of those?
So thank you for mentioning protective factors because it is so critical. And much of this research, yes, is grim, but the findings on protective factors, it gives us a clear roadmap for supporting LGBTQ plus youth mental health. Protective factors such as supportive family, friends, environments, those improve LGBTQ plus youth mental health and lower suicide risk over time. Family support was a strong protective factor associated with 62% lower odds of suicidal ideation. And so the bottom line about protective factors is that it is critical to improving the mental health outcomes for LGBTQ plus young people.
And we have just 20 seconds left. So in other words, it's not just that the numbers didn't rise, it actually, those protective factors made life better.
Absolutely. Those protective factors make life better. Absolutely.